Hello everyone. In this video, we will show how to do a kidney biopsy. This video is prepared by Dr. Manjit Mahendran and Dr. Samir Samar, junior residents, under the guidance of Dr. Upendra and Professor Dr. Naveed Vik, consultants in the Department of Medicine, All India Institute of Medical Sciences, New Delhi. We would like to give special thanks to Dr. Nishida Philip, senior resident in the Department of Nephrology, AIIMS, New Delhi. At the end of this video, you will be able to enlist the indications and contraindications of kidney biopsy, understand the procedure and the technique of kidney biopsy, post-biopsy care, as well as biopsy-related complications. Indications of renal biopsy. Nephrotic syndrome. Any nephrotic syndrome in adults, nephrotic syndrome in prepubertal children with atypical features of minimal change disease like microscopic hematuria, decreased complement levels, and failure to respond to steroids. Any acute kidney injury accompanied with urine active sediments, or to rule out any alternate diagnosis in suspected drug-induced or infection-induced active interstitial nephritis, a kidney biopsy might be done. However, before performing a renal biopsy, it is essential to rule out any obstruction or decreased renal perfusion or acute tubular necrosis. Systemic diseases with renal dysfunction. Usually, diabetic nephropathy does not warrant a renal biopsy. However, if a diabetic patient presents with glomerular hematuria or with no retinopathy or neuropathy at the time of presentation, or any renal disease of acute onset with diagnostic dilemma, or with associated immunological abnormalities, renal biopsy might be performed. Other diseases like small vessel vasculitis and antiglomerular basement membrane disease might require a renal biopsy for diagnosis. In a systemic lupus erythematosus patient, renal biopsy is done if protein excretion is more than 500 mg per day, or if there is active urinary sediment with persistent hematuria with 5 or more RBCs per high power field, most of which are dysmorphic or with cellular casts. Also, if there is a rising serum creatinine levels that is not clearly attributable to any other disease, then a renal biopsy might be done. Renal transplant patients presenting with renal allograft dysfunction, a renal biopsy may be required to look for graft rejection. However, it is essential to rule out ureteral obstruction, urinary sepsis, renal artery stenosis, or toxic levels of calcineurin inhibitors before proceeding with renal biopsy. In unexplained CKD, a renal biopsy establishes diagnosis in 50% of cases if kidneys are of normal size. However, extensive fibrosis and scarring may hinder the diagnosis. A repeat renal biopsy might be needed in patients of lupus nephritis or corticosteroid resistant frequent relapsing minimal change disease to look for a possible misdiagnosis of focal segmental glomerulosclerosis. Contraindications of renal biopsy. The absolute contraindications of renal biopsies are small kidneys, uncontrolled bleeding diathesis, and uncontrolled hypertension. The other relative contraindications are solitary kidney, acute pyelonephritis, perinephric abscess, renal neoplasm, multiple cysts, uremia, obesity, uncooperative patients, and the inability to lie flat. Workup for renal biopsy. Before performing a renal biopsy, it is essential to have following investigations. A renal imaging should be done, which should show 2 kidneys of normal size, unscarred and unobstructed. The diastolic blood pressure should be less than 95 mm of mercury. The urine culture should be sterile and hemoglobin should be more than 9 gram per deciliter. Coming to the coagulation status, platelet count should be more than 1 lakh, prothrombin time and APTT should be less than 1.2 times the control, and bleeding time should be done if urea is more than 120 mg per deciliter or blood urea nitrogen is more than 56 mg per deciliter. If bleeding time is less than 10 minutes, it is acceptable. If it is more than 10 minutes, then desmopressin 0.4 micrograms per kg 2 to 3 hours before biopsy can be given. Now we will have a look at the technique of a percutaneous native kidney biopsy under real-time ultrasound visualization in prone position. We will need a ultrasound machine with curvilinear probe, ultrasound gel, alcohol-based surface disinfectant, povidone iodine, surgical cut-down set, 2 10 ml syringes, 20 gauge IV cannula, number 11 surgical blade, automated biopsy gun of size 14 to 18 gauge, sterile gloves, local anesthetic agent, 3 vials containing formaldehyde, glutaraldehyde and normal saline. A proper informed consent should be taken from the patient after explaining the possible complications. Measure blood pressure, pulse rate, respiratory rate before start of the procedure. The patient should be able to lie in prone position and withhold breath in inspiration for few seconds without any difficulty. The patient is made to lie down in prone position with a pillow beneath the abdomen which acts as a wedge. Now locate the lower pole of the kidney with ultrasound probe in the lumbar region as shown in the video. Ask the patient to hold breath in inspiration and mark the corresponding area over the skin. Now use povidone iodine soaked cotton wiping in an outward spiral to disinfect the area. Put on the whole towel over the marked site. Ensure that the ultrasound probe is covered in a sterile manner. Inject local anesthesia in the marked area and infiltrate the tissue till the capsule of the lower pole of the kidney under real-time ultrasound visualization. This is the automated biopsy gun. This is how the biopsy gun is loaded and this is how it is fired. Load the biopsy gun and insert the biopsy needle over the marked area under ultrasound guidance. Now you can see the needle reaching the renal capsule in the video. And once the renal capsule is reached, ask the patient to hold breath in inspiration. Now the trigger is pressed and the biopsy gun is fired. The biopsy gun is removed immediately. Achieve hemostasis by compressing the site deeply for 5 to 10 minutes. The same procedure is repeated again to obtain a second core of tissue. Transfer the biopsy specimen over the dorsum of the left hand. With a surgical blade, the specimen is divided and sent for investigations. Adequacy of tissue sampling. An ideal tissue should be cylindrical with a minimal length of 1 cm and diameter of 1.2 mm. A typical biopsy sample will contain 10 to 15 glomeruli. For an adequate diagnosis of glomerular disease, at least 5 glomeruli are needed. For diagnosis of tubular interstitial diseases, at least 6 to 10 glomeruli are needed. And for transplant kidneys, at least 7 glomeruli are required. The ideal way of dividing the two biopsy core tissues is as shown in the figure. For light microscopy, the sample goes in formaldehyde. For immunofluorescence, it goes in normal saline. For electron microscopy, the sample goes in glutaraldehyde. A tincture-soaked cotton pad with a plaster should be applied over the site. Once the procedure is completed, it is essential to dispose the waste. The sharps should be disposed in puncture-proof box. Blood-stained cottons and pads should be disposed in yellow container. Gloves and infected plastic waste goes into red container and paper waste will go into black container. Post-biopsy care. Patient should remain in supine position for around 8 to 10 hours. Monitor blood pressure, pulse rate and urine color. Perform ultrasound abdomen to look for hematoma. If uncomplicated, the patient can be discharged in 18 to 24 hours post-biopsy. Complications of kidney biopsy. Loin or back pain might be experienced in 30 to 50% of cases. Bleeding might be a complication which might result in retroperitoneal hematoma in around 75% of patients, of which only 5 to 10% are symptomatic and requires transfusion. Severe cases might require angiographic embolization in around less than 0.5% of patients. The other complication is arteriovenous fistula, which occurs in around 0.5 to 10% of biopsies. These are asymptomatic and resolve spontaneously. Nephrectomy resulting from a kidney biopsy is a rare event with a frequency of less than 0.01%. Hope this video was useful for you. Thank you.